So what if I told you there was a way to help your Achilles tendon pain get better without going under the knife in surgery? So my name is Dr. Keith Bangart. In this video, I'm going to talk about the ways that we can help you get better without having surgery, utilizing PRP and shockwave therapy. So there's a common misnomer when it comes to Achilles tendonitis. Oftentimes people say, oh, I have a heel spur in the back of my heel. I have this tendon that's just not getting better. I see patients all the time where they come in and often they're saying, I have this heel spur. And I'll always tell them it's not the heel spur that's causing the pain, it's the Achilles tendon and the injury to the tendon. So what's happened is, I like to use the analogy of a fire in a house. So if you had a fire in your kitchen and the fire is going off, we go in and extinguish it, and now there's all this damage. And so traditional treatment is more aimed at just extinguishing the fire, and then we rely on the body to heal. So in the analogy of the fire in the kitchen, if there's all that damage, what's going to repair the damage? And so oftentimes you're going to call somebody to come in, repair the damage, remodel the kitchen, and now you have a brand new kitchen. When we relate that to the human body, we're relying on the body to send down its remodeling crew to help that tendon get better. And oftentimes though, that the body, after being hurt for so long, just kind of gives up and quits. And so the beauty of PRP is that we're going to harness the remodeling crew of the body, those healing powers, and enable the body to start to heal. So with growth factors in the body, that's in the plasma, and then the platelets also have these growth factors, and they really regulate and kind of the general contractor for the healing response. And so when we're able to take PRP from your body, concentrate it, and then inject it directly into the area that's injured, we start to stimulate this healing response. So similar thing happens with surgery. When we go in, traditionally I would go in and make an incision, go down to the level of the tendon, and I can actually see the injured tendon, and there's a difference in the tendon from healthy tendon to injured tendon. And as we cut out that tendon, basically creating this brand new injury, and then again, I'm just relying on your body to do its thing and heal. And sometimes it doesn't do it as fast as we want, but sometimes it does. And surgery can be effective, but it has a lot of risks with that. There's infection, there's significant downtime, especially when it comes to Achilles tendon surgery. It can be anywhere from a 6 to 9 month recovery minimum. If it's a rupture, it's 9 to 12 months minimum with loss of function and extensive physical therapy. But if we can get you better without putting you through the risks of surgery, problems with healing from an incision, from infection, missed time off of work, the expensive costs of therapy and surgery centers and other doctors' fees, PRP is a really good way to do that. So if you found this video valuable, hit like and subscribe and drop a comment below. And if you're in Arizona, I'd like to be your go-to resource for non-surgical options to get your pain better. I'm Dr. Keith Bangart at Restorative Edge Clinic.